RSV? What, another vaccine?
We really should have spaced out your vaccinations.
Stick around to learn what RSV is and why the RSV vaccine is important. At the end, we'll answer the most important question about how long the protection from an RSV vaccine lasts. RSV, otherwise known as respiratory syncytial virus, is a common cause of lung infection. RSV most severely affects children, causing hospitalization and even death due to severe lung infection. In most adults, RSV only causes mild symptoms, but for those older than 75 and those with heart or lung conditions, RSV can cause severe illness. The peak season of RSV infections ranges from October to January. Each year, about 160,000 adults over the age of 60 are hospitalized due to RSV, leading to 14,000 deaths per year. To prevent hospitalizations and severe illness from RSV, 3 vaccines have been developed. The 3 vaccines are Abrixo, Abrexi, and Mresiva. RSV attaches to cells through a fusion protein, also called the F protein. The F protein has 2 different shapes. One is before it binds a host cell, called the pre-fusion state, and another form after it binds the host cell is called the post-fusion state. Trials have shown RSV vaccinations against the pre-fusion state are more effective as it prevents RSV from binding to cells, and because there are more targets for the immune system to attack on the pre-fusion F protein. So who should get the RSV vaccination? RSV vaccinations really help those who are 75 years of age or older and those from 60 to 74 years old that have medical conditions that place them at higher risk for more severe illness. These conditions include COPD, asthma, diabetes, and heart failure, to name a few. The vaccination was studied in the Renoir trial. In the trial, one group who got the vaccine was compared to another group who got a placebo or fake vaccination. Each group was evaluated to see if they developed an RSV infection and to what severity. RSV infections were categorized into those with RSV and had 2 associated infectious symptoms, those with RSV with 3 associated infectious symptoms, and finally, those who developed severe lung infection. So what did the trial show? The RSV vaccination was 66.7% effective in preventing RSV with 2 symptoms, 85.7% effective in preventing RSV with 3 symptoms, and 62.1% effective in preventing severe lung infection. In terms of side effects, besides localized irritation at the injection site, there were similar rates of side effects from both vaccination and placebo. Clearly, the RSV vaccination is effective, but how long does its protection last?
All right, we'll get the vaccine.
A follow-up study of the Renoir trial looked to see how effective the RSV vaccine was at preventing infection in a second RSV season without receiving any booster vaccination. Keep in mind, the percentages here will be a little bit different than in season 1 of the Renoir trial, because some of the participants were lost to follow-up. So the vaccine effectiveness in season 1 was adjusted to only reflect those who followed up for season 2. For RSV infections with 2 symptoms, the vaccine went from 65.1% effective in season 1 to 55.7% effective in season 2. For RSV infections with 3 symptoms, the vaccine went from 88.9% effective in season 1 to 77.8% effective in season 2. For RSV infections with severe lung illness, the vaccine went from being 62.2% effective in season 1 to 36.9% in season 2. What does this mean? The data shows that RSV vaccination still does a good job in preventing milder forms of RSV with 2 or 3 symptoms, even into the second season without a booster. As for severe lung infections, the effectiveness drops significantly, though the vaccine still provides a 37% effectiveness in preventing severe infection. So will a booster be needed? The CDC is currently studying the effectiveness of the vaccine going forward, and a booster is not needed at this time. In fact, a new requirement starting November 1st by the Centers for Medicare and Medicaid Services is that hospitals need to report RSV hospitalizations each week to CMS to help understand the burden of RSV infections on communities. My suspicion is that an RSV vaccination will be needed every other year in those at highest risk. But we do need to see what the developing data tells us. Well, that is why the RSV vaccination is so important. If you'd like to learn about bird flu and what birds, pigs, and Missouri have in common, click here or check out the link in the description below the like button. I'm Dr. K from iMedicalSchool, and remember to keep learning.